critical governments shift health systems from the inequitable one-size-fits-all approach towards models of people-centered care that integrate mental health and NCDs in primary care settings, making services accessible where and when people need it most. This is the fastest way to closing the mental health and NCD treatment gap.
The political declaration before you today sets out ambitious but achievable goals by 2030. 150 million with access to mental health care.
We urge Member States to close the treatment gap by committing to invest in mental health and integrating it into universal health coverage, to embed mental health into primary care and community-based services.
We must strengthen primary health care as the foundation of universal health coverage.
And may be required to travel hundreds of kilometers to access basic mental health services, if such services are available at all. They frequently endure long waits, sometimes for hours or even days.
Treating the body without treating the mind leaves people only half cared for. By 2030, citizens everywhere should be able to find mental health support at their local clinic.
We bring high-quality, evidence-based, first-line depression treatment and suicide prevention to people in their own communities.
The mental health law establishes a rights-based, community-oriented model of care. The Philippines is integrating NCD and mental health care into primary health care.
Across these countries, the eyes of the young suicide attempt survivors and their families reflect not only the professional support they need, but raw fear of legal consequences.
We must urgently work to decriminalize suicide, including doing away with language like committed suicide, which criminalizes a person losing their battle to the anguish and pain that they're suffering.
We must be accountable through data, fairness, and openness. And we must confront stigma by decriminalizing suicide, deinstitutionalizing care, and adopting inclusive community-based solutions.
A child or young adult in my country grows up with layered insecurities: climate chaos, joblessness, digital overwhelm, and unspoken generational pain. Yet 83% of those needing mental health support don't receive it.
Around the world, people struggle with their mental health, not least children and young people. They wait too long for help. They are met with stigma instead of support.
And while statistics help us understand scale, mental health is also about dignity, about every person's right to live, to be heard, and to heal.
Mental illness is among the most persistent non-communicable diseases, yet too often it remains invisible. Its burden on health, productivity, and dignity is greater than any other chronic illness, but stigma still silences voices.
Both NCDs and mental health are profoundly shaped by the circumstances in which we are born, grow up, work, live, and age.
So many of the risks to health now come from outside the traditional health sector.
Considerando que la salud mental está profundamente influenciada por las circunstancias en las que nacemos, crecemos, trabajamos, vivimos y envejecemos,
we need a health in all policies approach, which takes into account the various determinants of health: social, economic, commercial, and environmental.
Lived experience is expertise. It's a discipline and it's a social movement in our intersecting spaces.
The lived experience of people affected by NCDs and mental health conditions must inform policy and program implementation across the life cycle.
We are not just here to advocate for ourselves. We are here to advocate for you, all of you in this room and all of you not in this room watching us right now.
Above all, we believe that people living with NCDs and mental health conditions and their caregivers must be at the center of solutions.
Our stories, our struggles, including mental health, and our insights must help shape the future of healthy systems everywhere.